I mean, we figure that no matter what you do, it's costing us at least $20, probably more like 25 to set up a room. Between the time the assistant sets the room up, all the disposables, so on and so forth. So, every time the patient doesn't have to come in, we're saving at least that amount. But then on top of that, our doctors aren't as busy seeing these quick, 90% of the Invisalign appointments where, yeah, everything looks good, which is great. That's what we should be seeing. But if we're spending a day doing that, then you didn't have any actual revenue that came in. And remember, we're a GP office. We're not set up as an ortho office to just have people coming in and out of the door. Everything looks good. Everything looks good. So for us, it's really freed up the ability to do other procedures, and we can deal with a button that's popped off here, or an aligner that's lost there, um, in between patients, and not have to waste that chair time. Kind of going back to the, if an attachment falls off, that's a big one too, because as everybody knows, if you go and you look at the ClinCheck or the treatment plan, you can kind of determine if we're at a point where we even really needed that attachment still. Sometimes, patients are terrible historians about what's happened. So they'll, say, oh yeah, it's the upper right, and it turns out it's the lower left. So when we have that picture where we can actually see what's attached or not attached, it helps us make the decision of, do we need to get them in and reattach that? And most of the time we find that we can get by without changing anything. So that's been good for us as well.